Hey everybody, this is Terry Mitchell from the Voice on Fire interview series. So for those of you who may not have watched or heard via my YouTube channel or my podcast, Voice on Fire is a platform for me interviewing change makers, difference makers, life influencers. They're people that may have founded something, created something or curated something. They're having a global impact. They may be making an impact at their local community level, but they're making a difference. One person, one community, just making a difference across the world, and that's really, really important to me. And today my guest is Daniel Dahdah from Sydney. Hey Daniel, how are you?
Terry, nice to be with you. Pretty well, thanks.
Excellent, excellent. So Daniel is going to be talking with us about the project that he's really passionate about, and Daniel and I have actually known each other for quite some time, and he was the chiropractor that made a difference in my life when I suffered quite a significant injury. So we may even touch base about that and talk a little bit about that if it comes up. But I want to give the opportunity for Daniel to talk about what it is he's passionate about and the project that he's currently working on. So Daniel, welcome, and tell us a little bit about who you are and what it is you're doing.
Terry, I am a chiropractor by training, and my education has allowed me to sort of move into that theoretical model of an understanding of the body and how the body works. So I have a practical application, what's called biomechanics, of what we do to ourselves. And does that actually make an influence on our quality of life? And so I'm happy to report that through years of asking questions and getting answers and thinking along a different sort of paradigm, that yes, we actually do have the potential to heal ourselves from many unexplained conditions, that reality has actually taken place and has now been turned into a system of care that can easily be implemented. And the beauty in that sort of simplicity is that it allows people to say, I can do that. I can, for example, change my sleep position, or I can change the way I put my papers down next to my keyboard, whether it's on the right side of the keyboard or on the left side of the keyboard, or when I'm in conversation with people or watching a screen of sorts, I know where to position my head. Now, that sort of thing about us having control empowers people. And that's what I'm passionate about. I'm passionate about empowering people to make a change in their health, in their quality of life. And that can be in a number of ways. So I'd be happy to share more about that with you as the conversation unfolds. But that truly is my passion.
Absolutely. And I personally can speak very, very personally about the change and the difference that just something as simple as a change in sleep position made for me. And just without obviously spending too much time talking about our previous involvement, it might just put a little bit of a spotlight on what it is you do. I'd injured myself. I'd fractured my sternum quite a few years ago and twisted my pelvis, and several ribs were not sitting properly, etc. And despite many efforts from various different practitioners, nobody really understood how I'd hurt myself, in the sense that how did my body respond to the injury and what did my body do when it was injured. I knew I was badly injured, but I just didn't figure out why I hadn't recovered properly. And when I finally found Daniel, I was a little bit disappointed when he wasn't prepared to give me any sort of treatment. It was like, no, we need to know what's going on first. And he did a lot of exploratory examination type stuff. There was x-rays of various things, because Daniel needed to know for sure what was wrong before he was prepared to do any sort of treatment that satisfied me first. It was all about finding out what I needed properly. And it was within 6 months that Daniel had me back at the gym for the first time in my life. Being able to sustain exercise for a prolonged period. It was probably the fittest and healthiest I'd been. And one of the key things that Daniel gave me to do was to sleep on a different side in my bed. So it was something as simple as that. It was a few other things, but let's explore just why that's important, Daniel. What is it that you've discovered? How did you make those connections and associations to the difference in the central nervous system and those different things that you talk about?
Terry, I was a practitioner, and I wanted the best for my patients, and I was unable to deliver.
Mhm.
And I knew that I'd actually had a tremendous education. It was a privileged education at the Chiropractic College in Sydney and also at University of New South Wales with anatomy. And the reality is that I had great mentorship as well. So I had all of these things at my disposal. But really, it's the school of hard knocks. It's the school of interviewing people and finding out what they're doing that may actually shed some insight as to how you can advance a person's health. And I realized, Terry, that there are three things that are required in order for people to make breakthrough.
Mhm.
They have to know how to get rid of pain. They have to know what to do themselves to help themselves stay out of pain. And importantly, Terry, they need to know what to avoid to stop the repeat cycle of practitioner visits, pain, relief, pain, relief, pain, relief. Now, when we take all of those three things, and three things have to be working together in order to make breakthrough. You can't have two of the three leading to breakthrough. It actually has to be all three together. You have to know how to get rid of pain by doing some self-help strategies yourself or from your practitioner. We're not going to say that practitioners aren't helpful in any way. They certainly are. But empowerment means autonomy.
Mhm.
And when you can actually empower a person, what you can do is you can actually set them on a road towards having more freedom and choice. In addition to that, they need to know what simple activities, whether that be horizontally or vertically, in bed or when they're up, they need to know how to position their head in certain ways or use their body in certain ways, bend or reach or lie. They have to know how to do those things in certain ways that turn on switches that activate the healing. Now, I'm a believer, and I see this all the time. People have a remarkable ability to heal, regardless of whether they've had that problem for 10, 20, or 30 years, or how complex that condition is, whether it be chronic fatigue syndrome, or menstrual irregularities, or bowel upsets, or autoimmune conditions. The body has a remarkable ability to heal. And it didn't have to be that way, but it is. And I see this in people that are 15, 5, 2, 5, 20, 50, and 80 years of age. Even 80-year-olds have a remarkable ability to make a change to their, not just their pain, Terry. I don't want to just leave this at a pain level, but it's working about processes inside the body. So we're talking about menstrual regulation. We're talking about bowel irritability, such as chronic constipation or explosive diarrhea, or needing to plan your trips because you've got this incontinence issue. The body has a remarkable ability to heal when you position it and hold those positions out of habit. Mm-hmm. That's actually a really good news message. And it's my job now to share it with people and to make it accessible via some of the things that I've been doing. So I'm happy to say that I've been writing a book, and the book is called Unexplained Illnesses, and it's almost ready for publication. But in the book, it outlines these strategies, practical strategies of what to do, what to avoid, and how to get rid of pain. Mm-hmm. But it also teaches people, Terry, to think a little bit more hopefully and expansively. So there's a mindset that we have that we're all grown up in. And that mindset is that you actually have to take something to control how your quality of life is. Yep. And that could be an antidepressant. It could be an analgesic for period pain. It could be something else to stop anxiety or heartburn and reflux or bowel issues as well. Well, I'm just happy to say the body is interconnected. I know a lot of people understand that the body is interconnected. But when it comes to it, we really like to see the results. And so we've got ways now of demonstrating, Terry, a remarkable ability, a remarkable way to show how the body is interconnected from, say, for example, a sore hip to menstrual irregularity.
Mm.
And I'll explain that for you. It's not a difficult process to explain. But if I could just use a small model, by the way, our body is fairly well interconnected. You'll see here on the model that there is the spine, the neck here, and the brain sits at the top up there.
Mm-hmm.
And through the whole comes the central nervous system.
Yep.
Now that central nervous system exits nerves on either side, the left and the right side of the neck. Well, underneath your ear, Terry, is a very intricate piece of architecture where the nerves that exit from this level underneath your ear are influenced by your sleep position.
Mm-hmm.
So, for example, a person with hip problems, Terry, might not be able to sleep on that sore hip. It's just too painful. Even the contact or the weight of their body causes them to roll off the hip, and it causes a change in sleep behavior. Now, that positional change in your sleep does something else. It sets off a domino where your head position now starts to change because of pillows or hand positions.
Mm-hmm.
And that actually starts to send signals coming through the neck. And those signals through the neck, particularly underneath your ear, actually convey messages to organs in your body. Now, that particular nerve that I'm talking about, that's called the vagus nerve.
Yeah.
And it gets its name vague because it wanders throughout the body. And it wanders all the way down, Terry, to areas like your colon, your bladder, or your uterus. Now that, I realise, can all sound a bit fanciful, but it's a small little way of showing how a hip problem, because you've been bending down and putting your right leg forward, puts all of the body weight through that right hip. And then after a while, it stretches the ligaments in the ball and socket joint, and that ball and socket joint starts to stretch the ligaments, and those ligaments don't like stretch, Terry.
Mm-hmm.
So they start to send signals back to the brain, and it feels like you've either got pain on the point, so you can't lie in it, or you've got pain going down the outside of your leg, and it feels like a gnawing, aching pain that's just burning down the outside of your leg, or it could even refer into the buttock or into the groin. Mm-hmm. So people invariably find that they have to compensate, and they make changes to other behaviours, such as their night or their day behaviours. And those changes have a domino effect on nerves. And when we start talking about the nerves that exit from this area up in here, we start to see now a connection between hip pain and bowels, hip pain and palpitations, or hip pain and menstrual irregularity.
Yeah.
So that's just a small little connection, Terry, about mechanics and the simplicity of habits and how it actually drives a change to behaviour. And that change in behaviour then has knock-on effects. And I know that what I'm doing there is sort of taking you and potentially your listeners on a journey of understanding the domino effect. But really what we want to do, Terry, is we want to see the changes unfold. So what I've done is I've created something that makes it possible for you to see that your menstrual cycle has changed over a period of months, and your bowel habits and your energy levels. And we have a tool which is currently being worked on, Terry, in an app to help people track on a daily basis their symptoms.
Okay.
So what we're talking about now are symptoms as a means of measuring quality of life.
And
I hope that makes sense.
Yeah, it does. It does. Symptoms are the thing that we identify with. It's like we're often asked, well, you know, what are your symptoms? And it's such a roll off the tongue comment. It's because we've been educated to know that check your symptoms. What are your symptoms? Oh, well, I've got a fever, or I feel like I've got a tummy ache, or I've got cramps, or I've got a sore toe. Whatever those symptoms are, they are just what we know subjectively what's going on. And for those who may not have any sort of familiarity with, you know, the biology, the anatomy, and any of that sort of stuff, who just know the basics as taught in school, there's no real vested interest in understanding the entire mechanizations of the body. So that's why we have specialists like yourself, someone who does invest in that area. So when we talk of symptoms, it's like, well, that's the only way I know to convey that I've got a problem. And then we hopefully find someone with a specialty interest like yourself who's able to say, hang on a minute, we know more about the body than just the symptoms. We understand the pathways and the patterns of those symptoms and what it all means. And I've myself got familiarity with the vagus nerve, and I've certainly heard a lot about things like the digestive system being the second brain and things like that. Just to sort of come back a little bit, Daniel, to the clinic that you founded. Now, I believe I've said this rightly. It's the Centre for Unexplained Illnesses. Is that correct?
That's right, Terry.
So what are some of the things that you have noticed? What sort of people are you seeing in terms of symptoms that they show with versus the actual problems that you're finding? What sort of, kind of maybe go into a little bit of more detail with that and share with us what you're finding?
Well, Terry, my book is on unexplained illnesses, and the book has actually been targeted towards people with chronic fatigue immune deficiency syndrome.
Okay.
Now, those people generally have a quality of life which is very poor indeed. Some of them are actually housebound, Terry, so 1 in 4 of them actually cannot leave the home. And they're not old, many of these people. Some of them start in their teens, and 10, 15, 20 years later, they're still suffering. And it's quite a devastating illness to cripple a person who has so much potential and so much life and so much gifting to offer.
Yep.
And for the limitations of their body, they just cannot express themselves the way in which they were designed to. Yep. So the potential is certainly gone. So what I'm seeing now, Terry, is that people like this have an abundance of symptoms to present with. So they're going to have not just energy level issues, but they will actually have menstrual irregularities. They will actually have bowel upsets as well. They'll have chemical sensitivities. They'll actually have skin issues such as itchiness or sensitivity to the skin. You know, sometimes an abundance of sort of pimples down the back of their arm or on their back as well. So it's indicating that there's a whole system sort of involvement in these type of people. And the symptoms themselves are a way of tracking now, well, if we actually showed that your energy levels in the morning or during the day or in the evening had changed, and we can use like a 10-point scale to determine what your energy is like at its worst or at its best or an average, we start to target those sorts of incremental changes in energy. Well, we start to see changes in a matter of days or weeks.
Yeah.
Now, once you identify the pattern of irritation to the central nervous system, now there is a pattern, Terry, I've sort of jumped the gun a little bit, but there's a pattern that we found, and it's in the shape of a zigzag pattern that goes down the spine.
Oh, wow.
Now, if you stimulate the spine, either via manipulation or via making changes to certain habits, such as sleeping on this side or sleeping on that side, you can actually activate the healing potential in the person. If you stimulate that pattern out of pattern, so you're going in the opposite pattern to what you actually should be doing, the person will actually deteriorate in their quality of life.
Wow.
Now that's a big statement to make, Terry, because what it means is that we have actually found a handle or a controlling mechanism that we can turn on and or turn off healing in the body. Now, the way of identifying the bigger context on that, Terry, is that, well, what happens if it's turned off for a period of time? Well, the literature is fairly clear on this. If you actually have bowel upsets, Terry, in your teens, 20s and 30s, well, you're actually more likely to cancer of the colon or the rectum in your 50s. The literature is fairly clear on that. And if you can say the same thing with menstrual irregularity, well, then actually you're more prone to either ovarian or uterine issues later on as well. And the literature has established that link. coming forward, if we can identify the pattern of nerve irritation in the body, perform certain stretch procedures. It doesn't have to be manipulation. Manipulation is something that many practitioners do, physiotherapists and osteopaths and GPs and chiropractors, they do it. But if they're doing it out of sequence, then there's problems. And that's the reason I suspect, Terry, that why some people in the population are going to experience success with a chiropractor and others won't.
Mm-hmm.
Some people are going to have limited success because, yes, they go to the chiropractor and he helps them or she helps them, but it doesn't last.
Mm.
Well, that's unfortunate, but there is a breakthrough. And the breakthrough is that once you've actually identified the pattern to work in, you complement it by teaching people how to position themselves in ways that activate healing and not inhibit it.
Wow.
Then what you're doing is you're giving the empowerment
Mm.
and control to a person to say, well, Daniel, you asked me to sleep more in this way or more in that way or more in that way. There are 3 positions where you can activate that healing.
Mm-hmm.
But if you start to do that, you'll see people with chronic fatigue syndrome and the abundance of their symptoms change. And there have been breathtaking responses to care in that regard.
Yeah.
So it's a very exciting thing to say that, you know, whilst we may specialise in certain areas, I guess my specialty area as well has been to establish what it is that people have to do to help themselves and what they have to avoid to stop hurting themselves in order to retain the improvements and make them last as long as it can, you know. And I'm happy to say, Terry, that a lot of the consultations that we do now are actually done via this medium, Skype, Zoom, and that's how powerful the recommendations are. So, you know, what comes to mind is a gentleman who referred 3 other people with chronic fatigue syndrome to me, and they were on the other side of the globe in Ireland.
Oh, wow.
So he got better after over a decade of being housebound. His marriage was severely tested, and he was unable to work, and he was housebound for 5 years. But the symptoms had been going on, affecting his family. All of his family were concerned for him. Well, he recovered. And then he sent along 3 other people with immune issues. They recovered.
Mm-hmm.
And that's over in Ireland.
Yeah.
And here we are. Here we are in, you know, Sydney or on the eastern seaboard, and we're seeing that there's potential in changing your habits.
That's
the
just
model.
It's astounding, but it's such exciting news. And again, speaking personally from my own experience and what it was like to have the care that you provided, I was well aware at the time that there was not another practitioner doing what you were doing. I was aware of that, and it was, to me, it was a little scary in one sense that I left Sydney, as I was obviously living in Sydney at the time when I was a client of yours. And I left Sydney to return to Victoria. And I just knew that I would not find another practitioner who would have that same level of awareness and the model of practice that you implement with your clients. And it really fascinates me that you've just mentioned that there's a way to actually help people just using other modalities or other, not modalities so much, but other technologies. So as you're mentioning with these sorts of technologies like Zoom, with regards to what you're finding, you've been mentioning that there's a particular illness that you have identified that you're working through and that's mentioned in your book. Is there any other project that you're working on that you've found that you've had significant changes, and anything that you'd like to share with the listeners?
Terry, there's a lot that's going on at the moment, and at the moment I'm running a trial for 50 ladies who are, and we're just opening up that trial. On May 28th, we had International Women's Health Day. Mm-hmm. And that's when I actually started the registrations for this trial on helping women from 15 to 45 years of age who have got menstrual pain, irregularity, clot sizes, breast tenderness, abdominal cramping, emotional irritability, cravings, all sorts of symptoms that go premenstrually or menstrually with a woman's time of month or their health issues. And that trial is now open. And, you know, people are certainly welcome to contact me via the St. Jude's Clinic contact details, which I'm sure we can leave, you know, in the details description on this video. But the idea of supporting women is actually to take a very topical and very common complaint. So approximately 80% of women are going to have some sort of menstrual dysregulation. And that's a significant amount of women who are suffering, a significant amount. So in order to be able to support them, I'm using a trial of 50 ladies to gather a more wider interest and to actually start to spread the news about what is it that women can do to support their own quality of life, and also the people that they're connected to, whether they be in a relationship with somebody, because there's going to be domino effects occurring relationally, and also occupationally. A lot of women absent themselves or can't concentrate at that time of month. They just lose productivity. The quality of life is severely impacted as well. And unfortunately for them, many of them go on and they will develop some sort of sinister pathology in their 50s and 60s. Well, I take the symptoms now, Terry, work with your symptoms, and if you can see changes in your symptoms, such as my clot sizes have disappeared. My breast sensitivity I couldn't even brush my hand past it. I couldn't lie on it. You know, now it just doesn't bother me. Or the premenstrual symptoms such as, you know, I know I'm grumpy. I just can't talk to me 3 or 4 days or a week beforehand because I'll either cry, I'm emotionally unstable, or I'm grouchy, or what have you. You know, there are so many ways in which women can be really supported. And I'm just happy to present what I consider to be a first for ladies in saying you've got to link it to sleep positions, you've got to link it to head positions, and we can take that and we can actually work with those 50 people. I believe that approximately 70 to 80% of women, Terry, are going to respond in a significant way, powerful way. Yeah. Wow. And it's going to save them a lot of heartache. Yeah, a lot of heartache. And I'd like to be able to share more about, you know, what it is that our body's interconnectedness, our integration can really affect. But you asked me the question, I don't know if I answered it properly, Terry, but there are bowel issues, you know, that tendency to not a sluggish bowel, that can improve. People should be going daily. Should be going on first things on waking, really. Within 2 hours of waking, they should be emptying their back passage. You know, many people don't have that. In fact, many practitioners don't even bother to ask that question as to when you go, you know. But the idea of taking a history, as you had mentioned earlier, was that, well, you know, Terry, I've got to understand what's going on. I've got to understand not just your medical history, but I've got to understand where you spend your time, what you love doing, and what it is that may actually be identified as a risk. So if I create a risk profile and understand that these symptoms, I'm expecting that there's probably some sort of dysregulation, which I'm going to give a name. It's called dysautonomia. All right. And that's basically a dysregulation of your central nervous system, and it expresses itself in symptoms. So when we take a look at a patient-centered approach, we're going to be talking their language. We're going to be talking symptoms, and we'll be using the symptoms as a goal. Yes, breast sensitivity, 8 out of 10, 9 out of 10, dropped, you know, 2 out of 10. Cup swelling has gone down. I don't even need to have that extra bra, you know, or pain levels in the abdomen or the uterus, or the idea of heavy bleeds, embarrassing bleeds. We can actually start to use symptoms as a means of forming what's called evidence-based care. And that's the big buzzword in science and practitioners at the moment. You need evidence. It's all good to have an opinion, but you need the evidence. And I'm more than happy, Terry, to use evidence-based care because I believe it's accountability.
Mm.
And I think patients deserve that.
Yeah, absolutely. I gather what you also mean when you talk about taking the history and having that evidence is it's a way for also the client to feel more empowered, because when you bring attention to, let's talk about these symptoms, tell me on a scale of 1 to 10, what does it feel like to have this, and this? It's putting the attention for the client onto those symptoms and giving them a way to themselves think in terms of, I've never really thought about how much it hurts, but yeah, I would say, look, that's a 7. So they've got that idea in their head, so that over the period of time that you're dealing with their symptoms and not dealing with them, but helping the client to come to terms with what's going on and giving them the methods to work with, they've got something at the end of it. Yeah, the language. And when it's at that end point, when you've gone through the process with them, you can then come back to and say, well, this was marked 7 out of 10 before. What are you feeling now? And then they're able to get it. They're able to see the progressive change. So it's really valuable that there's a way that people can gain some sense of control. And I think that really helps people to find confidence again in the healing process, because my experience, and I know that mine's fairly unique, but just in terms of understanding other people, the experience that we have of being medicated by doctors, because that's obviously endorsed by the pharmaceutical companies, and we all know that. The idea that everything has to have a medication prescription for a treatment, to me, is denying the patient the right to understand their own body, and it takes away their right to feel empowered. And it's not to say we shouldn't have a medication in the interim to help us to deal with something initially, if that's what we have to do. I certainly don't say, stop taking more medications. That would be irresponsible of me. But the idea that, do we always need the medication? Is there another way? And, I've often found myself to be criticised from the medical profession because I refuse to fill the script. And they've asked me why I'm not taking a medication. And it's like, well, I actually had this conversation with a practitioner yesterday and said, I choose not to take the medication, the pain medication that's been recommended to me, because if I take it before I'm diagnosed, I don't know what symptoms I'm masking, and that way I don't know if I'm potentially hurting myself because I can't feel what's going on in my body. If I take responsibility and allow that pain to be present, it means that I then know where it's at. I can feel it. I can identify with it. And then when it comes to actually explaining that to a practitioner, I'm giving a clear, unmasked version of that symptom. And that way it's a clearer picture for them. And it also means that my body's not tainted with all the toxic residue of pharmaceutical medication, which could be having an add-on effect. So, I have my own reasons for why I believe medication needs to be the last resort, not the first. And I'm really, really keen to understand where to from here with what you're doing, Daniel, in terms of, I can see there's so much scope. This doesn't just play out for the unexplained illnesses, because really at the end of the day, almost all illnesses kind of fall into that unexplained, because otherwise you get labelled with a medical diagnosis and they're not necessarily helpful. What do you see is where you're going?
Well, I'd like to just share a little bit on that point there, Terry. Diagnoses carry their own burdens, not just the symptoms, but the weight of a diagnosis can actually be quite impactful. And if somebody is told that they actually have MS or they have cancer, then there's a heavy psychological burden that actually comes down on that person. Yep. However, Terry, I do want to be mindful of the fact that we all belong and we work in a big system. I guess what we're trying to do, Terry, with this model of care is re-establish an equilibrium. You see, your body has its own marvelous ability, its wisdom inside of itself to heal. And I'm not going to deny that. We see that every time we cut ourselves, we don't actually instruct or send messages down to that cut. Intentionally, it happens. It's a remarkable body that would actually do that and clean up the debris around the area and cause wound regeneration. So the idea, Terry, of that diagnosis becomes impotent, or the effect of that diagnosis becomes impotent if there are no symptoms. I don't mind having cancer, Terry, as long as I don't have the symptoms. I don't mind having MS as long as I don't have the symptoms. After a period of time, what takes place is our quality of life is not really determined by the diagnosis. It's determined by the symptoms.
Mm.
And patient-centeredness is very important. So when we start to have an impact on symptoms itself, we know we're affecting quality of life. So much so that after a period of a month, we might start to get some hope back. But after a period of 6 months, our brain starts to say, you know what? I'm cured.
Mm-hmm.
No symptoms for 6 months. It's now become a memory. In actual fact, what happens is we recalibrate and we start to think, well, I wonder if it was actually MS all along, or I wonder if it was an autoimmune condition all along, or I wonder if it was actually a lazy gut all along. Now, I know, Terry, that I'm not 100% effective for everything. But what I have seen is that 70 to 80% of my people with menstrual, bowel, immune problems are improving. Now, I'm starting to expand that model, Terry, into this habit-driven health perspective, because it's our habits, which I'm saying are actually driving your health for a lot of conditions. Now, if I have somebody that comes to see me with MS, I'll be looking at their symptoms.
Yeah, of course.
You know, whether they've got numbness in their hand, or whether they're limping now, or whether they've got pain or headaches or something else that's going on, I'll actually be looking at changing the symptoms. If I can use an evidence-based care model with that and grade it on a daily basis, because I do believe, Terry, the body is capable of making change quickly. Quickly. And that's exciting.
Yep.
But if we see trends unfolding so that the symptoms in repeat day after day after day after day, that actually creates a sense of context and it creates a sense of reliability. If I see the symptoms improving across the board, such as limping, numbness, feeling, pain and headache, then I'm starting to see impact.
Yep.
Now what I'm starting to see is the severity of the condition, how it impacts a person's quality of life, is also making a change as well. So now what we're doing is we're introducing a whole systems model to a person. We're giving them a currency or a language with which to speak and relate, develop a rapport with their practitioner, which is so difficult to do for patients. Patients can't even remember what they had for lunch yesterday, let alone how they were feeling yesterday. Yeah. Add some brain fog into that, and it's going to be even more complicated.
Absolutely.
You know? So what we need is an accountability and a visibility to tracking symptoms, which fulfills the question mark areas of unexplained illnesses. It fulfills the blank, which says, well, you know, you can still operate in this model of care, even though I'm a chiropractor. And what are you doing talking about menstrual irregularity? You're a chiropractor. That doesn't make sense. All right. Well, in actual fact, chiropractic is only what I've studied. All right. My official recognition. But what I can treat actually has to be based on my results and my tracking, my accountability. Because ultimately I'm going to be shown for either being a charlatan or somebody who made a breakthrough, depending on how I can prove those results. So we do have a model of care which allows my patients accountability and context and rapport and building trust. It does so much more than all of those things as well, but it's a very important thing. And so the diagnosis, Terry, that you said, it's fine. We've got a diagnosis. We could put that on the shelf sometimes and just leave it there. We're not going to throw it out. We belong in a bigger model of care. There's biomedicine. All right. That's the pharmaceutical type of medicine where there's a lot of specialties. And then there's whole systems approach as well, which I've called biosystems, life systems. All right. And we're along that continuum in our lives. Ultimately, most people would actually like to be governing themselves, ultimately. They don't want to be relying on the other end of the spectrum where they're taking things to get by all the time. But admittedly, some people will have to be down there. But for the majority of us, Terry, I'm actually a believer that we have got so much ability, capability in us to say, you know what, I didn't realize that you could control my heaviness of my flow, or my chronic fatigue syndrome, or my nightmares or my night terrors,
Mm.
or my migraines or my dizziness or my many ears disease or my vertigo, I didn't realize that you could do that sort of thing. Well, we don't know until we track, but I'm happy to say that after 30 years, there's a lot of reason why I should continue doing what I'm doing.
Absolutely. And, you know, and I come back again to the fact that I myself am literally, and even you were, you know, obviously witness to the success that you had with me, being somebody who could not, there were so many things I just couldn't do. And the physicalness of my body had changed so dramatically. I think you had seen me, and I was probably somewhere between 3 and 5 years post-injury. And so I had lost 3 to 5 years of my life just being, and I was someone who was very fit. At that stage, it was nothing for me to jump on my bike and ride 17 Ks a day just because I loved the experience, or to run 8 Ks, or to, you know, to join a dance class and dance for 2 or 3 hours straight, because my level of activity and my physicalness was just very high energy. And the moment that I had the fracture, everything stopped and I became instant couch potato. So for the first 7 days, my life was just zeroed out. It was like complete nothingness and sitting on the couch. And then for the next 3 years, it was just piecemeal trying to get, and I guess the thing that influenced this was trying to get to the doctors of the world. And I don't have any disrespect for the medical profession as such, but I do think that there are good and not so good doctors out there. And unfortunately, there are too many of the not too good types who want to brush the symptoms off. A lot of the time, I personally have found that symptoms are often claimed as being in the mind, and here's some painkillers and just go home and rest. And I was actually told just to take some painkillers and go home and rest when I'd fractured my sternum, because at the very time that they saw me at the clinic, the x-ray showed nothing, so there was nothing wrong with me. And that was literally clinically what they determined. There was nothing wrong with me because nothing showed up on the x-ray. And it took, I think it was about 10 weeks by the time I actually had a nuclear scan, where they had the injection of that nuclear medicine that set on the fracture site, and that showed up on the scan. And it was at that point they said to me, "Oh, it's an active fracture." And I was a bit dumbfounded by that. It's like, you mean to say I've been living with this fracture for all this time? But that seemed to be the whole focus of what they were worried about. Whereas in my mind, I was aware that I'd injured my whole body. You know, fast forward 3 to 5 years and I see you, and you focused on my whole body, and which side was I sleeping on, and how did I do this, and which way did I do that, and let's swap it over and only do this, and let's just do these things. So there was a whole pattern of what you got me to do, and it was a very initially slow process for me, but it was a long lasting process. And I think if we can get to that point where we're listening to the symptoms that people show up with and put it into a whole body context, because at the end of the day, if I fracture my sternum, is it just the sternum that's affected? We have to look at what's been the impact. And in my research, you know, you have to have something like a 900-pound force to fracture the bone. When you think about what a 900-pound force is that has to fracture that bone, that is a significant amount of force. So what does that do to the rest of the body? And as you say, if you're diagnosed, what kind of mental state does that place you in? And if we keep handing over everything to our medical practitioners who don't always get it right, what quality of life do we have, and when do we stop owning our own bodies? And I'm a really big advocate to that.
I'd just like to interrupt you for a moment there as well. There are a couple of points that I'd just like to pick up on. One is the habit-driven health model actually is distinguished by the fact that it doesn't require major trauma to develop a chronic illness.
Yep.
Many people that come in actually have not sustained any major trauma at all. It's repetitive micro trauma.
Yes. Yep.
It's the repetitive stretching of certain joints which are surrounded by ligaments, which inside of those ligaments have switches which send signals up and down to the brain and down through to the body as well. When we start to activate those switches in our joints themselves, it creates all sorts of interesting knock-on effects as well. I do want to applaud biomedicine. Biomedicine has delved into specialty areas that have increased our level of understanding considerably. For example, take the idea of that nuclear medicine scan as well. It is able to visualize something that could not actually be visualized in the past, you know? And it's a phenomenal gift to us all that we actually have biomedicine in our armamentarium to help us understand more about the body. What biomedicine has done is often, and unfortunately so, has tried to dictate to the body how to heal, as opposed to guide the body in its own healing processes. And there's a big difference between trying to control a mechanism and trying to encourage one that's already there. So we have in our own bodies this wonderful ability to be able to activate certain processes which then turn into symptoms or lack of in due course. So biomedicine, we all know that it has its place. We don't quite know where the resting position is in this equilibrium, or recalibrating that equilibrium to find out, well, what actually does fall under my control? Do actually some of the unexplained illnesses fall under my control as well? And should I be really pursuing a model that is quite holistic, not invasive? It actually doesn't put anything into the body, nor does it take anything out of the body, and yet it allows the body to somewhat transform. That's powerful.
Absolutely.
Whereas unfortunately biomedicine might actually say, well, hang on, you've got heavy bleeding and you've had it for a long period of time. Your uterus needs to come out. Okay? And a lot of ladies have actually gone down that road because it's just an untenable situation. You can't live in that situation of flooding. You know, other people have lost their gallbladders, and other people have had so many urinary tract infections, and others have, you know, had problems with repetitive tonsillar infections and things like that as well. Well, this is all fairly new. It's going to be beyond my lifetime, Terry, but I'm happy to be at this starting starting point in the journey to introduce a model which has got actually a system to it for others, PhD students, to come along and say, you know what, we'd actually like to investigate the role of sleeping positions on flooding, or sleeping positions on premenstrual symptoms, or sleeping positions on the cause of bowel issues, you know, or immune issues, or autoimmune conditions, etc., etc. So the idea of putting this out there into the public will obviously be perhaps a little bit of a stretch, fanciful, but it's really an opening. It's really an opening for others to come in and say, you know what, you may have something. I don't necessarily believe it to begin with, but you're speaking my language through symptoms. That means a lot to my patients. I'm interested to hear a little bit more, or I'd actually like to research that as well. So I believe that that's where we're at, Terry. We're at our infancy, really, in terms of sharing this model of care called habit-driven health with people. Now, I'm only one person, but my goal really, where to from here, is I want to educate practitioners. So I've got my book almost ready, up to the 4th edit, Terry, it's killing me. But but people should be able to pick up Unexplained Illnesses from their bookshops before the year's out. Fantastic. All right. And there are courses inside the book. Now, the courses themselves do cost, and I think it's important to mention something there, Terry, because the dreams of promoting this multinationally and training practitioners as well is very important to me. And it's important, and it obviously needs money to do that. So in some ways, I'm inviting people to support the vision. And the vision is to empower individuals to a greater quality of life through that model of care, that understanding of how to activate the body's healing. So there are courses in there. The courses themselves have a nominal fee compared to what you get for the course. And those courses themselves will teach practitioners how to use their hands, how to interpret what's going on with their hands. It's a bit of an issue globally for practitioners. There are courses to teach people how to get rid of hip pain. Ball and socket joint issues change the sleep behaviour like no other condition, really. Well, I mean, you can have your partner breathing on you, or you can have light coming in and you don't like it, or so and so and so and so. But pain is a big driver of change to habits. So I just thought I'd pause there, Terry, and just share with you a little bit of what I've been doing. I hope it does support you and your initiatives and your work in being a voice on fire. I thank you very much for, giving me the opportunity to share.
Oh, absolutely. It's been an absolute pleasure. And it's really valuable to be able to explore what options there are for people, because, in reference to my own situation, yes, it was driven a lot by the diagnostic tools and by the doctors. And it was really refreshing to be in a position where someone was willing to empower me to help me heal myself. And I was able to recover quite significantly from that particular set of conditions that were affecting me. And I'm fully supportive of anybody that gives somebody the power to identify their own quality of life, or a way to bring about their own quality of life. And I know that that's what you are doing, in so many ways. So I'd really love to say thank you so much. And as anybody who may be listening to either the podcast or watching this video, Daniel's contact information will be available in the descriptions for both the podcast and for the video. If you would like to contact Daniel, by all means, all of his contact information for his practitioner services are available in the description. If you'd like to buy his book, also follow him up with regards to that. It has been an absolute pleasure. Thank you so much, Daniel. I've really appreciated your time, and what a fascinating conversation. I really look forward to seeing where it all comes to for you, and totally support what you do.
Terry, again, for the platform, thanks for the opportunity. I'm looking forward to sharing more with you in due course.
Excellent. Thank you, Daniel.
Cheerio, Terry. Bye.